Hi, my name is Chrissy Reichert. I'm a student at Indiana State University in the Doctor in Athletic Training program. Today I'm going to talk about positional release therapy, PRT, versus active release technique, ART. Both of these techniques are myofascial release techniques that can be used on a variety of conditions. The first we're going to talk about is positional release. Positional release uses a position of comfort to reduce tension. So in your mind, I want you to think about how you stretch a hamstring. You're going to have them supine. You're going to have them in a straight leg raise going as far back as they can. But in positional release, you're going to be starting in the absolute opposite, totally opposite of stretching. So you're going to have them going into knee extension and hip extension and knee flexion to make that hamstring as short as possible. It can be used in acute, subacute, or chronic stages of healing. So that's a lot of the times where it's not as aggressive. So in acute settings, when you have that decreased range of motion, it's something that can be used as well as chronically over time. It is used by it's trying to decrease the stretch reflex that is sustained due to somatic dysfunction. So basically what that means is your muscle, any muscle that's having this dysfunction, is in a constant stretch reflex, and so it creates tension in the muscle belly and can also create adhesions, which decreases range of motion. Now, a super fun fact about positional release was that it was actually discovered by accident. The researcher he was working with one of his patients, and the patient was describing how he has a hard time finding a comfortable position to sleep, and eventually when he does, he's able to be basically pain-free and be able to sleep through the night. So the researcher put him in that position. So in this case, it was actually the fetal position. He was a low back patient, and the researcher walked away to be with another patient, and when he came back, essentially the original patient was pain-free. So it was just kind of a fun fact and how it was discovered, and even the researcher himself was like, yeah, it was an accident. So the technique itself is, what you're going to do is hold the muscle in a position of maximal shortening for 90 to 120 seconds. So again, if you're taking the hamstrings, you're going to have them in that hip extension and knee flexion for 90 to 20 seconds, and you're going to slowly return them back to a stretched position or back to neutral. Now, I know some of you must be thinking that it sounds a lot like strain counterstrain. Strain counterstrain is actually a type of PRT because you are moving them into a relaxed position. But in strain counterstrain, you're really going to be focusing on those myofascial trigger points. So you are going to have slight pressure on a sensitive area or a tender spot while you move them into that relaxed position, or while you're in that relaxed position. Now I'm just going to take a few of these examples in the chart here, whereas PRT is more of a whole body. So you're looking at increasing flexibility by decreasing tension and adhesions that are going to be, that can be in any muscle. It doesn't necessarily have to be due to a myofascial trigger point. Whereas, like I said, strain counterstrain is going to be. Now, strain counterstrain also is usually held for only about 90 seconds. It can be a little bit more aggressive because you are having that direct pressure on that tender area. But PRT, you're going to hold it usually for about 90 to 120 seconds, but often it is used until the patient feels relief. So those are just two different areas where they do differ. Now, the active release technique. The active release technique utilizes manual pressure, tension, and shear forces. It does this by promoting elongation. So that's the number one thing on trying to decrease adhesions, decrease tension, and trying to elongate that muscle. Now, like PRT, you're going to be starting in a relaxed position, but you actually are going to be moving into a stretch position, which is unlike PRT, which you're going to have that sustained relaxed position. It's contraindicated for acute conditions. This can be rather aggressive, and so having that acute inflammation or that acute pain or redness or heat can often be made worse through active release techniques. So you're going to be seeing these most often in subacute and chronic conditions. Now, if you look to the right, the technique is showing how this is specifically for the adductors. So, as you can see, the clinician has applied pressure to a point of adhesion, and he's going to be moving them from that shortened position to the lower picture, which is going to be that lengthened position. Now, depending on what the goal of the treatment is, it can either have one bout or a couple of passes to get the adhesions out. So if you're looking at a trigger point, you can do a single bout and try and get that specific area of adhesions out. But if you're looking at elongation of the entire muscle as a whole, oftentimes you'll see 1 to 4 passes in that locked position where the clinician is going to be holding that muscle, is going to be getting closer and closer to the insertion, about 4 centimeters apart from the previous spot. Now let's take a look at an example. I've chosen the hamstrings because in my patient population, flexibility is not their strong suit. And also there's only one of me and about 9 of them, so I'm always looking for different ways that they can do their own stretching or things that can further benefit their flexibility, even when I'm not present. So first we're going to take a look at positional release therapy. So that in one study we saw that when compared to passive stretching, actually passive stretching had a greater increase in a sit and reach, which tests hamstring flexibility. It was about a little bit greater than 4 inches, whereas the positional release therapy was about 3.75 inches of increase. Now, these aren't statistically significant differences. However, when you do look at it, you are seeing a greater increase with that passive stretching. Now, a different study showed a sham treatment versus a PRT. And there was no statistical difference in that popliteal angle. So a popliteal angle is the patient's going to be sitting with their legs straight ahead of them, trying to push their knee to the table, and then you're measuring that popliteal angle in the back of the knee. The sham treatment in this study was just a passive 10-degree hip extension when the patient is supine. And so that was just, it wasn't much of a stretch as you saw in the previous study. Now, when we look at ART, when compared with a Mulligan bent leg raise, so what that is essentially the clinician will be moving the patient's knee to their chest. We saw that ART had a higher degree of increase when we see in popliteal angle. So that was a really cool thing, as you have about 16.5 degrees of increase when you have ART, and then that bent leg raise was about 9 degrees of increase. So a pretty substantial increase when compared with just a Mulligan bent leg raise, which essentially is a bent knee stretch. And in the same study, they looked at sit and reach also, and ART had about 4.6 inches of increase, whereas the bent leg raise has 2.7 inches of increase. So although I didn't find any specific hamstring literature comparing the PRT to the ART, it was interesting to find a couple of different articles that use the same types of outcome tools. So as you can see here, the positional release therapy was not as beneficial with stretching as ART. So, but of course, it should be all results should be incorporated conservatively to make sure that it does fit in with your patient population as well as the needs of your patient. But overall clinical bottom line is we are seeing that in the hamstrings to increase flexibility using the sit and reach test and popliteal angle, we are seeing that active release technique is going to be increasing that flexibility just a little bit more. And it may not be statistically significant, again, since these are two different articles and they didn't compare them directly, but the cool thing is that we do see that increase, and it's something that we can take it into our clinical practice, and maybe that 1 degree, or that 1 inch reach is really going to make the difference between injury and non-injury. So if you guys have any questions, here my works cited. It was very interesting to learn about since I'm not from a manual therapy background. So I hope you guys learned something, because I know that I definitely did. Thank you for your time.